Hello, good afternoon, everyone. Welcome to our webinar, and our topic today is navigating early motherhood. So first-time mothers usually have a huge anxiety surrounding pregnancy, delivery, the early neonatal period. And we have two guests here, myself, who would guide us through this period, and we'll take questions and answers afterwards. My name is Dr. Omireyo Obaze. I'm a mom as well as being a doctor. I have two incredible guests with us today. I'll introduce the first one. Her name is Tolu Adeleke Aire. She's a health educator, a nurse, a midwife, a health consultant. She's internationally trained and has 10 years clinical and management experience, both in private and public sector. She's also one who truly believes in consistent and constant health education, raising awareness and empowering people to take charge of their health. We also have Titi Medunoye. She's the first internationally board certified lactation consultant with 8 years management and leadership experience. She's also the founder and CEO of Milky Express, which is Nigeria's first lactation company. She also is the founder of the Milky Express Breastfeeding Foundation, which also gives free eye and dental checks, infant general checks, as well as general health screening. She's also an advocate for women empowerment. You're both welcome to our discussion this afternoon.
Thank you very much.
Thank you so much for having me.
How are you doing today?
I'm very fine, thank you.
Okay, so we'll just go straight into it. Pregnancy, the whole journey, delivery, the early stages of an infant's, timing, and there's so much myths, there's so much fear, regarding it, and it helps when we have people that have gone through it, people that are also certified to guide, new mothers through this process. So thank you both for joining us today, and we'll just get into it. So Tolu, I'll start with you. Pregnancy jitters, is there a thing like that? Is it normal, and is it something, to be worried about, and being worried about the whole delivery process?
Yes, pregnancy is, before I go into that, I just want to say thank you for this amazing opportunity. I hope women take a lot away from today's webinar. So pregnancy jitters, yes, it is a real thing. It can also show up as a form of anxiety, worrying, being nervous, because a lot of the times, especially for first-time moms, there's so many unknowns. They don't know what to expect. They don't know what's going to happen. And I find that the negative stories, or the just not so pleasant stories, tends to make the rounds quicker than the positive stories. So most pregnant women would have heard of something terrible that happened to somebody else when they were pregnant, not knowing that actually having a baby is a beautiful and a pleasant experience, and it can be a positive experience. So yes, it is very normal. As a midwife, I try and encourage all moms who are feeling like this to talk about their feelings, talk about if they're feeling anxious or worried, talk about it to someone. Also, attending antenatal classes is great because it prepares the mother. She can ask a health professional all the questions that she's a bit worried or a bit anxious about, as opposed to Googling. Also doing positive affirmations. I'm a big believer in positive affirmations. So confessing, saying positive things to yourself daily about yourself and about your pregnancy. Yeah, so it is real, and those are my solutions for it.
So what should they expect during the pregnancy, Tolu?
Oh, okay. So at different stages of the pregnancy, there are different things that are happening. So I'll talk about the first trimester, what to expect in the first trimester. The most common one is your body is going through so many changes. So I think I read somewhere once or an interview with a new mom, and she said in the course of her pregnancy, her bra size changed 8 different times. So that's how quickly your body is changing, and that can be quite hard for a lot of women to accept. To accept, and it also feels like your body's not your own for some women, not for everyone. So it can feel like your body's not your own. So that's one of the things that happen. So I think if you're psychologically prepared that your body can change and will change, it's not so terrifying when you're going through it. Also, mood swings. I think women report this, but more than the women, their husbands report the mood swings of partners, because the hormones, pregnancy hormones that's keeping your pregnancy going, keeping your baby growing and developing, can also have a woman feeling all sorts of emotions, and it can happen within seconds and minutes. So also mood swings are quite common with a lot of women, and husbands will say that as well. Once again, in the first trimester, women have a heightened sense of smell. Once again, it's hormones. So all the things that are happening I blame it on the hormones. But the reason is we think the reason is that it helps your body to sense when something is off. Like if you're going to eat something that is quite off, so it's just protecting your baby. It's one of the reasons. So heightened sense of smell. And then there's nausea. And people say nausea is actually worse than vomiting. They would rather vomit because it's that consistent sicky feeling at the back of your throat. Saying that, for nausea though, in Nigeria, I know a lot of women have put cola nuts. They put cola nut in their mouths to stop them from feeling nauseous. So recently I discovered that actually contains caffeine, so we're not supposed to put cola nut. So you can find alternatives to that. So there's nausea, and then we call it morning sickness, but sometimes it's not morning sickness, it's everyday sickness. So that's something that happens to some women, not all. And then finally, some women have an increased appetite, which is amazing, but remember, we're not eating for 2 in the pregnancy. So just to make healthy eating choices as well. So those are the common symptoms or what to expect in the first trimester of pregnancy.
Yeah, I think ginger also helps. Some people have said ginger helps with the nausea. So that's another tip that you can take away from it. So throughout the course of pregnancy, how many times should one attend antenatal care?
So it depends on, so the World Health Organization, let's start there. The World Health Organization says women should see their midwives or obstetrician, depending what the system is where you're from in your country, at least 8 times. And the first visit should be before 12 weeks. So the first visit is what we call registration or booking, and during that appointment, it normally takes a bit longer because they'll ask you a lot more questions about your medical health, social health, previous obstetric history, and then they'll use it to plan your care, see if you need to be referred to anyone else, maybe a dietitian, physiotherapist, whatever. And they'll use it to plan your care, and then you should have a subsequent at least 7 visits. Saying that, if you have an obstetric history, maybe history of miscarriages, stillbirths, if you're having a multiple pregnancy, just if there's any deviation from normality, having one baby, first baby with no other problems, then you might need to have a few more appointments. So the basic is 8 appointments, but it can deviate and you might need more depending, and also what happens in your pregnancy as you're going along.
Okay, great. Thanks for the initial pregnancy period. It can be a little bit daunting for some people, and like they say, no two pregnancies are the same. So you can have a really smooth first pregnancy, and the second pregnancy can come with a barrage of issues, you know. Yeah. So how would a first-time mom know she's going into labor? I think I'll throw this to both yourself and Titi. How would an first-timer know that, okay, I'm going into labor and I should get to the hospital?
I'll say a few and then I'll let Titi say a few as well. So ideally, one of the most common signs of labor is contractions. And I say contractions sometimes and people still say, what is that? So it feels like your stomach or your abdomen, your uterus actually is having a spasm. So it's, like a spasm. So it's tightening and then relaxing. That's the most common sign of labor. But also that happens early on in pregnancy, what we call Braxton Hicks. That is not, Braxton Hicks are not, they're practice contractions and they're not painful. So the painful ones are contractions. And when it becomes regular, so every 10 minutes, every 15 minutes, then you know that you are actually in active labor. So that's the most common sign. When your waters break, but your waters don't always break. Your waters don't always break, or sometimes your waters break and you won't go into labor. But that's another common sign of labor. If you lose your mucus plug, so the mucus plug is what covers the cervix, the neck of the womb. So once your mucus plug goes, it's also known as a show. So once that goes, then it can be a sign that your labor should start soon after that. Over to you, Titi.
So I think you've covered it for signs of going into labor, but I would share my personal experience. So I have two babies, and I had my first daughter. I had an awful pregnancy, to be honest. Like, it was a drag. I was in and out of the hospital like pretty much every month until she came. And when she came, my water broke. Like, I was just sitting in the car and I just felt very warm, warm wetness. And it was very strange for me because a lot of times people will always say that, I just always felt that it was only in the movies that you could start labor with your water breaking, so I didn't expect that to happen, but my water broke. And then, from there, it was a whirlwind of an event. But, I think in addition to what you said about the water breaking, I think that if your water breaks and you haven't started active contractions, I think you should go to the hospital, because this now reduces, the amount of protection that your baby has in the womb, and also means that your cervix is open, which could be an avenue for infection. So if your water breaks, you should get ready. You should, just head on to the hospital. And also, you should look for the kind of water that comes out. If it's clear, if it has like things in it, like it has like brownish or greenish, dark greenish things in it, we know that, okay, baby has had the first poop. So it's important to get to the hospital as quickly as possible. And for my second pregnancy, it was a breeze. So I had my second pregnancy and it was like I was not even pregnant. Like, I did every single thing on hyper extra drive. So, and of course, with labor and delivery for my son, for my second baby, it was actually pretty easy. I started with contractions this time and not my water breaking. It started with contractions, but I had very good control of it, and eventually gave birth. I had a vaginal delivery, so I had a VBAC for my second child. So I always tell people that I think I've experienced both worlds when it comes to both pregnancy and labor and delivery.
Yeah, I agree with you. Personally, I didn't really know when I was in labor because I didn't have the show, and I have 3 kids. So like you, Titi, I've experienced both cesarean section and a normal delivery. So for my first child, I didn't really I didn't notice the show, but I just felt uncomfortable. And then the contractions started before the show came. And it was quite an experience. Now, saying that, during the period of labor, how would you advise women to manage it? Because you really can't tell or explain to someone this is how labor pain feels, because we tend to get those questions. So what's the pain like? What do I expect during labor? So how would you advise and guide you mothers during that particular period?
So I think that, I'll just share from my personal experience, and Tolu can give us more of a professional side. I think that, so for me personally, because I knew that I wanted to have a VBAC, which is a vaginal birth after cesarean section, I did quite a lot of research, and I met with a gynae, I met with a midwife, and I met with a doula. And all of these are birth support people. And I did extensive research. And this is very funny, but I think that it was very, very helpful for me, okay? So I did extensive research, and I wrote down something called a birth plan, okay? So a birth plan is just things that you would like to happen during your birthing process. So a birth plan is usually not cast in stone, because anything can change, and you have to be open to the fact that it can become a medical emergency and everything will change. But a birth plan was pretty much for not just myself, but my birth partner. So my husband and my mom, who were there with me, for them to know exactly what to do when I feel certain things going on. So for me, I felt like contractions, the early on stage of contractions, from about going from 1 centimeter to about 7 centimeter, I felt like that was like a heavy, like a times 100 kind of cramps, like period cramps, right? And there's just always been a way to be able to manage period cramps for me. So learning about posture, during the pain. So I learned that, and I did it, and it worked for me. So when the contractions came, if I felt it in my back, I would lean forward and let the weight of the baby be on my tummy instead of my back. I didn't sit still in bed. I was walking around, I was standing, sitting, but I wasn't lying down to try to get things going quicker. And so I told my mom and my husband exactly what they needed to do, so when they felt a contraction coming, my husband would rub my back, my lower back, apply some counter pressure, all those kind of things. Because I think that, the birth plan is actually important, so that our birth partners don't completely lose it and they don't know what to do, and everybody's there and everybody's confused, and everybody expects you, who is in labor and who is going through the discomfort, to come up with solutions or tell them what to do. So from 1 to 7 centimeter was like that, but from 7 centimeter to 10, it was no longer like a pain, it was more like now a pressure, right? I wish there was a way to explain it, but it just feels like you have the huge need to go to the bathroom to do a number 2, and you're just trying to hold it, like, so for your time to do number 2, you have to wait. Like, imagine that you've gone out, you need to use the bathroom, but you have to wait until you get home. So it feels, it's no longer, the pain wasn't as bad from contractions. It just now felt more of a pressure. And I just had to be telling myself, it's not time, just hold it in, literally, because your body wants to expel the baby. So you have to tell yourself at that point, not time. So that's my personal experience. I'm sure Tolu can give us more on professional side on how to manage pain during labor.
Thank you.
I think you've said quite a bit, Titi, and I remember seeing a type of video or a picture of Titi in labor wearing the hospital gown, walking down the corridors. I think it was a video, walking down the corridors.
Yes, it was a video.
I think that's exactly what you have to do when what you ideally should do when you're in labor. So labor is broken up into stages. So ideally, the early part of labor, which is from 0 when your cervix is still closed to 3 centimeters dilated, you should try and do that part at home if you can, and if there are no problems. Like Titi was a VBAC, so you're going for a VBAC, so you had to be in the hospital because she had a previous cesarean. But if you're low risk and there's no complications and everything is okay, you should stay at home, have a nice hot bath, walk around. If you can dance at the time, dance while you're having the contractions, because what's happening is your baby will put pressure on the cervix and put pressure on the cervix to dilate. So Titi said you can't be lying down in bed. It's one of the worst positions ever. Be upright, dancing. If you can't stand up or you need a break, sit on a birthing ball. It's like a yoga ball. Sit on a birthing ball, bounce around on that. Have a hot shower or hot bath, because we know that water is a really good form of pain relief. So you just do these things at home. Yeah, do these things at home to try and get you through the earliest part of labor. And then when you feel the contractions are regular, so if they're coming every 10 minutes, depending where you live, because if you live like 45 minutes away from your hospital when there's no traffic, especially in our Lagos, then you have to give a bit more time for when there is traffic or when it's peak hours. So when your contractions are regular, you have to then pack all your stuff, your hospital bag, make your way into the hospital. Even while you're in the hospital, though, still keep walking around, mobilizing, being upright. Your husband, birthing partners are so important. I love that you touched on that, Titi. Your birthing partners will just rub your back, give you lots of support, words of encouragement as well. Because you get to a certain point and you just think, I cannot do this anymore. So that's when they come in handy. And then obviously there's pain relief when you're in the hospital. So that's something you want to find out before you are in labor. What are your pain relief options? And like Titi said, have like a birthing plan or birthing preferences. So you know the options that are available, jot it down on your birthing preferences, what you think you would like when you're in labor. It might change, like Titi said, it might go all out of the window, but at least you know the options and it's not so foreign when you're in labor. What else would I say? Yeah, so painkillers, lots of support. And then keep eating and drinking, because you need the energy, you need the sugar from whatever you're eating, and you need to be well hydrated, because dehydration can also slow you down in labor. Those are the most important things of coping in labor. But yes, being upright and mobile or upright. Yes, that's what I would advise.
Okay, great. Thanks. So now we have the baby and it's time for feeding. Breastfeeding is a lot of mothers, want to breastfeed their children, and they also want to go the exclusive breastfeeding route. And so for some, it's easy, it's a breeze. But for others, there's a challenge to breastfeeding. And personally, I don't think I couldn't do exclusive, not for lack of trying, but for just not producing enough milk. And, the babies had to eat. And this is having tried all the different things you can try to produce more milk, and it wasn't. And so I was like, okay, breastfeed when you can, and then infant formula to supplement the rest. A lot of women put pressure on themselves to breastfeed, and they tend to get really frustrated when this doesn't pan out as they would want it. Titi, can you help with how new mothers can walk around the challenges of breastfeeding?
Okay, sure. I would, I'll get to that, but I'd like to even first of all start from, where you came from talking about breastfeeding and, the challenges. So research has actually shown that 70% of mothers will have breastfeeding difficulties, okay? And we say that breastfeeding, or according to the World Health Organization, breastfeeding is absolutely necessary and the best for babies between the ages of 0 to 6 months of age. Okay, and there's so many reasons why we have said this, or why the World Health Organization has given this advice, and obviously for the health of the baby and even for the health of the mother. Now, I think that we have held on to this advice or recommendation so much, but because we're not as knowledgeable when it comes to professional breastfeeding care or clinical breastfeeding care, we seem to always leave out the part to mothers that breastfeeding can be difficult. So even though breastfeeding is a natural process, it's not like it's an evolutionary process that, you just learn how to walk and you just learn how to talk and that's just how life goes. No. So breastfeeding is a very, very complicated, and I choose my words carefully, okay? So I say complicated because breastfeeding has to do with the mother and the baby. And at different pregnancies and at different times, the mother will change and the baby will change. So your experience in your first breastfeeding will be different from your experience with your second breastfeeding. So breastfeeding has to do with a combination of both the mother and the baby, and trying to ensure that there is synergy, in that relationship is what really gives the best breastfeeding experience. Okay, so we find that there are mothers who will, off the go, we know that they will have breastfeeding difficulties. And the truth of the matter is that not every mother can breastfeed. Not every mother can breastfeed, even though she's been able to carry a pregnancy. Not every mother, because breastfeeding, the ability to breastfeed actually starts from young age in little girls, from the period of development. Okay, so from the period of development is when your ability to breastfeed is actually predetermined. It's not even like when you get pregnant. So as you develop and as your breast develop, the tissues inside your breast that are responsible for producing breast milk, research has now begun to see that a lot of exposures that little girls have during puberty years, from the environment, chemical exposure in food, harmful things in food, and even in the environment, hampers the proper development of these tissues in your breast. So you find that, you find moms who have, large breasts, you see them and they have very full double D cups and you expect that they should be able to breastfeed. But these mothers don't have as much tissues, they're called glandular tissues. They don't have as much as they should have to be able to breastfeed, so their breast is usually sometimes it's just fat, just fatty tissues. So we find mothers like that, and in cases like that, you can already foretell. So you should have a pre-consult with a lactation consultant before the baby comes. And that consult is when we will see, okay, how is breastfeeding going to turn out? What are the indications in mommy's breast that we can see now and say, look, breastfeeding will be difficult. Please buy formula before you get to the hospital. We also do things like assess the mother's breast. So we're assessing her nipples. Does she have inverted nipples? Does she have flat nipples? Which may cause complications in terms of latching the baby. So if the baby is not going to be able to latch properly, the baby is not going to be able to get milk out properly, and the baby cannot get milk out properly, the breast is not going to produce the amount of milk that the baby needs, because the baby is not telling the breast how much milk he needs of that milk. So I mean, it's a process. It's like a whirlwind of things happening. It's like a domino effect of different things happening that will affect other things in breastfeeding. So breastfeeding is not easy, and it's not easy, and I must say that I really want to congratulate and praise mothers for giving it their all every single time. I've had 2 children. I had a horrible time breastfeeding my daughter, which was why I actually went back to school and trained to be a lactation consultant. And then by the time I had my son, it was a much pleasant experience.
Wow, good for you, because I wasn't so lucky. So it's interesting the way the body reacts to certain type processes that typically go on, and we all would love and encourage, mothers to try and do their very best when it comes to breastfeeding where they can. Now, Titi, you mentioned a few reasons why, a baby may not be able to latch onto, for example, the type of nipple. Are there other causes? Are there other things that might cause a baby not to latch properly to the nipple?
Yes. So another thing that could cause, a baby not to latch properly are, the baby's mouth, right? So usually, after the baby is born, the baby should have a proper assessment from a pediatrician. But however, during a lactation consult, the baby will also have an assessment, right? So we're looking at the baby's oral function. How well is the baby sucking? Okay. Some babies have, we find with preterm babies, for example, preterm babies don't have a good suck strength. So even though they're able to latch, they're not going to be able to pull out as much milk as they need to. We find that babies who have a tongue tie or a lip tie, and a tongue tie, because a tongue tie is very important. The tongue is very important to get milk out of the breast, okay? So the tongue usually, if you find that this is the tip of the tongue moves like this inside the mouth, and that movement combined with suction is what allows milk to pass out and allows the baby to swallow the milk. But when the tongue doesn't have that free flow of movement, then there will also be problems with latching. So we have tongue tie, we have lip tie, where the upper lip is clenched down, and so the lip is not able to open up and properly form around the breast. In that kind of situation, the baby will be gulping in air while breastfeeding because there's no proper seal, and the latch will keep breaking. So, there are so many things. Another thing could be positioning. So sometimes you just don't have the right position. You're just not putting the baby in the right position. Babies have some babies come out of the womb having a side preference. So imagine that the baby has been in the womb with the head facing the right, and the right, and the baby is comfortable with the head on the right position. But now you want to breastfeed the baby and you want the baby's head to move to the left. It's going to be an uncomfortable position for the baby, and the baby is not going to enjoy breastfeeding. So positioning also plays a huge role on how well, your baby is able to latch and enjoy breastfeeding.
Great. So one of the common things also with breastfeeding is cracked nipples. It's pretty common, and also some women, both the first timers and experienced mothers, have difficulties managing the cracked nipples and breastfeeding. What would be your recommendation and your advice in managing cracked nipples?
Okay, so with managing cracked nipples usually happen because, number one, the nipples are not properly moisturized. So what we find is that when we take our bath, so the skin, as we know, the skin brings out oil, and the skin on your breast will also bring out oil to keep your nipples moisturized, right? And when your nipple is moisturized well enough, during the sucking process, when the nipple is stretching, it's not going to break. Okay, and that's what happens usually when we have this cracked nipple. So, you're bathing too much, using too much soap on your nipple. You don't need to use too much soap when you're bathing, or don't even need to use sponge on your nipple, because you don't want to get rid of all that oil that's supposed to keep your nipple moisturized. Another thing that also causes that is not having a good latch. So I mean, on the moisturizing side, there are good nipple creams that you can use. that have good functions, to heal, to protect the nipples from, any kind of infection, and to also heal the nipple wounds. But the thing is, if you're not looking at correcting your latch, you will most likely always go back to having those nipple wounds and cracked nipples, because most of the time it's from not having a good latch. And not having a good latch could also be a result of something going on either on your breast or in the baby's mouth. So having a proper assessment, with either a pediatrician, a pediatric ENT, or a dentist on the baby's side to get a good assessment, to see where the challenges may be coming from. But all in all, solving the problem of cracked nipples will always fall back on solving the latch issues that you're having.
Okay, thank you. So the next question, I'll throw this to both of you. During pregnancy, because the question would flow from pregnancy into breastfeeding, we know that a lot of people like to self-medicate, and some people do it also during pregnancy. Are there things, normal foods as well as drugs, that should be avoided during pregnancy but can also affect breastfeeding? And what would be your advice, in terms of what they can take and what they can't take? I think we've lost Titi. Tolu, maybe you could.
I was going to say, Tolu, go ahead and take that first, since we're starting from the pregnancy side.
Yeah, sure. In pregnancy, things that you want to avoid that are things like uncooked foods. Uncooked foods, because of the risk of getting a virus or bacteria that crosses the placenta, and it can make you quite sick, and it might make your baby sick. So it's uncooked food. We say certain types of fish. So it's good to eat fish because they also have good nutritional value, or it's quite nutritional for the woman and for the baby. But there's certain fish that you can't eat, sort of like shark, swordfish, marlin. They're not the type of fish we normally have in Nigeria, and the reason we say that is because they contain high levels of mercury, so we know that can also cross the placenta and get to your baby. And then things like, so I've said uncooked food, changing cat litter, because it can contain a bacteria that can cross the placenta and affect your baby. So in pregnancy, it's just a lot of, it's foods like that, because you don't want to harm yourself or harm your baby. I think Titi will be better to answer for the breastfeeding part. But then also, sorry, before I just hand over, also cheese like Camembert, Stilton, blue cheese, because also it might contain these bacteria that can harm your baby in pregnancy. I say liver because liver is quite controversial, because people say it's packed with vitamin A, and it's good for mom and iron levels, but then we don't want the vitamin A getting to the baby. So I tend to discourage vitamin A in pregnancy, liver intake, or anything that has liver in it in pregnancy. Those are the ones I can think of off the top of my head. Titi?
Okay, so
Titi, you're on mute. We can't hear you.
I'm sorry. Can you hear me?
Yes.
Okay, great. So so with breastfeeding, there are no foods as such that I would say do not eat, but I would say that eat a very good balanced diet, right? That is very high in vitamin B, in omegas, and in folate. Those are very, very good for breastfeeding. But then most importantly, I always say that, moms should watch what they eat and when I say watch what they eat, I mean take note of what you eat and its reaction on your baby. So a lot of times, because breast milk is formed from our body stores of nutrients and also the nutrients from the food that we eat, there are times when moms will consume dairy foods and you find that baby is reacting to some proteins in the dairy foods. So you want to watch your baby while you're eating, watch your baby for things like rashes, excessive stool and things like that. It's a good indication that, because we find that these days we see more and more babies, or maybe because now we're just more knowledgeable about food allergies, we find that more and more babies are allergic to cow milk. So if you're consuming any food made from cow milk, which could be regular milk or like pastries that have milk in it, ice cream, things like that, we find that sometimes babies will react to it. So you just need to pay attention to what you eat and also its effect on your baby. But aside from that, there are no foods. Okay, well, there are foods though that have been seen to hamper breastfeeding. So foods like that have mint, like peppermint, things that have peppermint have been seen to reduce your rate of milk production, actually. So you can watch out for foods with peppermint or, peppermint sweets, and then stay hydrated. So stay on a lot of foods that have, large liquid content. Stay hydrated, at least 10 glasses of water a day. Those are very important for breastfeeding.
Okay, so now that we've spoken about what should be taken, what cannot be taken, how often would you say a mother should breastfeed her baby? Titi?
Hey, yes, I'm here. On how often a mom should breastfeed. Now, usually after a baby is born, there's only so much food that the baby can take in. So, I mean, day one of life, we're not clamoring to see how much milk you can give your baby. But then again, as your baby grows older, the need for milk will change, right, at different times of the day and even at different stages of life. So, but on a regular, from the newborn stage, we find babies breastfeeding every 1.5 to 2 hours for like at least 10 to 15 minutes. Okay, so this is the average. However, there are scenarios where we experience or where we see that there are some changes. So for a healthy baby, a full-term healthy baby, you expect the baby to feed every 2 hours for about 15 minutes. But if you're working with a preterm baby, we can't put that, you don't expect that kind of behavior from a preterm baby. So a preterm baby will need more food, first of all. So we'll expect that the preterm baby should feed at least every hour or 1.5 hours. But also with preterm babies, we find that they are more sleepy. So they tend to sleep through their feeding times. And, I know that feeding every 2 hours is not easy. Feeding every 1 hour, 1.5 hours is not easy. So I like to advise moms that it's okay for you to pump and someone will feed the baby while you rest. But at these times when, you are resting, let there be some sort of activity on your breast, okay? So if you feed your baby, for an example, if you feed your baby at 6 a.m. and your baby is going to take the next feed at 8 a.m., you can ask someone else. You can express breast milk if you have, and if you don't have, you can give your baby a formula, a bottle of formula. You can have someone else feed the baby at 8 a.m., right, while you're resting. But while the baby is being fed at 8 a.m., it's important for you to also pump at least for 5 to 10 minutes. Why? Because the way breast milk production work is, aside from breast milk production being dependent on your body stores of nutrients and your own food intake, there's also something called a feedback mechanism. And what that does is that when you take milk out of the breast, it tells your body, right? And it tells your brain that your baby needs more milk. So if more milk is not leaving your breast, there will be no replacement of that milk. So it's so important that, as more you continue to get milk out of your breast, even though your baby is not feeding, and this is also important for moms who have had a C-section and they're not able to breastfeed as quickly as possible. I always advise that we initiate breastfeeding at least within an hour after birth. But for a mom who has had a C-section and she's tired and she wants to rest, or maybe there's some complications with the baby and the baby is not there with her, you can start to pump as quickly as possible and make sure that every 2 hours at least there is even if it's 5-10 minutes, but there is something going on your breast that is causing suction and taking milk out of your breast and draining your breast.
Okay, great. We have a few questions that I'll just quickly take. The first one, Tolu, someone's asking, what should a mother-in-law do to support her daughter-in-law after delivery, and are those hot baths safe?
Okay, so I say for how would a mother-in-law support her daughter-in-law, ask how your daughter-in-law wants to be supported. So if that means cooking, then help her cook. If it means with chores or helping around the house or doing the washing and washing baby's clothes, I find that people who visit, or mother-in-laws, people who are visiting someone that's just had a baby, we like to help how we think they want to be helped, and that is a wrong. I think that's quite wrong. Ask her what she wants you to do. Will be a good way to support her. In the case where you have maybe shy daughter-in-laws, or because we're thinking of culture, tradition, and they can't really say, then it's doing the practical things like helping around the house, cooking. So making sure she doesn't need to be in the kitchen and cooking, even if she's had a vaginal delivery. You think everyone else, people get up and cook and do things. No, so helping her cook. About the hot baths, I don't understand what they mean by hot baths. Is it when you press the lady's body with a hot flannel and hot water?
I think it's two ways. That might be one. I'm also thinking for women who have had an episiotomy, there's this thing to you having to sit on hot water, and some people advise it, some people don't, So I think that's what that question is referring to.
Okay, so in terms of the hot, I know back in the days they used to do a woman was sitting over hot water with salt or something and the steam.
Yeah,
okay, so with that, I don't know if that's evidence-based, so I can't recommend that. But in terms of having a Sitz Bath, and a Sitz Bath is like a bowl that you put like warm water, just warm water, and they've designed something that you can literally put it over the toilet and then you sit in it. That has been shown to be quite good for wound healing and cleaning, if you've had an episiotomy, if you've had a tear. But that's warm water with nothing else in it, and you sit in it for about 10 minutes. You do that a few times during the day. That's amazing. That's fine. But with the hot water and the steam and everything else, no, I couldn't recommend that. I don't know if that's evidence-based. Yes.
Okay, thank you. Titi, there are two questions here that are for you. One is it okay to start moisturizing your breast during the early stage of pregnancy? And someone's also asking, what's the best position to breastfeed?
Okay, I would actually like to add something to what Tolu has said.
Okay.
In terms of the question that someone asked about hot water, just in case they're asking about using hot water on the mother's tummy after birth, because some people do that to say, to sort of help the womb contract, or sort of, help get out the blood, the leftovers blood and all of that. But I think that we should be careful with that, especially in times when a mother has had a C-section. Okay, I first of all, I don't know, like Tolu said, I don't know if there's any evidence, like clinical evidence to the effect of that. However, I do know that doing that when the mother has had a C-section is very dangerous, because there are times when I've personally had to deal with times when the mother's, incision has come open because you keep applying warm and wet stuff on the incision. So the mother had to go back, treat, because it then got infected. That had to be treated and had to do a restitch. So it's really dangerous. If you've had a C-section, especially, don't do that, okay? So with the breastfeeding question, yes, you can actually start to moisturize your nipples now from when you are pregnant. You can just use if you don't want to get nipple creams right now, you can always use coconut oil, olive oil, nothing fancy, no chemical based kind of stuff, just natural oils that you can use to cook, and or you can use as cream on your body. You can use that to moisturize your nipples. And in terms of breastfeeding positions, there's so many positions. You have the cradle position, which is what everybody knows. But I always advise, different positions for different situations. So, for example, for a mom who has had a C-section, I don't advise a cradle position. Okay, I don't advise a cradle position. The cradle position tends to put pressure on the mom's tummy, right, when the mom is holding the baby. So I don't advise a cradle position, and I don't advise a cross cradle. Let me bring this further down a little bit. So this is what a cradle position would look like. Okay, and the baby is here, and a cross cradle position will have the baby coming out from one side and will also be on the breast. So I don't advise these positions for moms who have had a C-section. I also don't advise a cradle position for moms who have very large breasts, because you find that because in a cradle position like this, your hands, so first of all, your legs are in the way. Okay, your hands are in the way, and then you literally have a few inches of space to fit your baby into. And then, you find that in situations like that, when the mother is struggling to hold her breast back from getting into the baby's face, or the mother is struggling to, hold the breast or position the breast and the baby. So if you've had a C-section, or you have, large, on the larger size, above a double D cup, then you can do a side holding position. It's called a football hold, where the baby is on your side. It could be the left or the right side, and the baby is coming in from the sides and breastfeeding on the breast. Okay, so you put the baby here to lie on your arm. Your hands is at the back of the baby's neck and not on the baby's head. Not the back of the baby's head, but the back of the baby's neck. And then you position the baby as such to breastfeed. Okay, you can also feed while lying down on your side, and the baby is also lying beside you, but just make sure that there's some sort of protection on the other side of the baby, and that you're not a deep sleeper such that you would hurt the baby while you're sleeping. That's also a good position. And also leaning back. So if you're leaning back on a chair or leaning back on something, you can have your baby lie on you or lie on your tummy. Obviously, this can work for someone who hasn't had a C-section, and even for moms who have had to have who had tears and stitches and episiotomy while during delivery. Sometimes they find it hard to sit down, so you can lean back, so that you're not putting any pressure on your butt, and you're not putting any pressure on the stitches, and then the baby can lie on your chest or on your tummy and then breastfeed in that position. But ultimately, you should find a position that is comfortable for you. It's so important. You don't want to be hunched back like this because you're breastfeeding, or on a weird position because you're breastfeeding. When you breastfeed, you are bringing your baby to the breast. You're not taking the breast to the baby. Okay, so take a position that is comfortable for you, and then bring your baby onto the breast.
Okay, great. So I have a question I want to throw to you. So we have this is more for new fathers as well. They also sometimes tend to be worried about sex during pregnancy, and so they're worried whether or not they should have sex with their wives whether they're going to harm the baby. The new mother also is worried, should she not? What is your advice to both mothers, new mothers and new fathers?
Okay, so in pregnancy, sex is perfectly fine. I think a lot of them think that if they have sex with their wives, that they're going to poke the baby or harm the baby somehow.
Mm-hmm.
But the baby's sitting in a sack of water. So if you can imagine a balloon that's filled with water, so the baby's sitting in that, and then that sack of water is sitting inside the uterus. So there's lots of layers before you even get to the baby. And then also the cervix, which is the neck, the entrance to the womb, is normally quite long and closed. So there's no chance that when you're having sex, you're actually touching or affecting the baby. I think that's always a man's concern or dad's concern with having sex in pregnancy. For the woman, it's perfectly okay if she wants to have sex. We know that at different trimesters that she might not be interested, especially in the first trimester where she's really tired. She's really tired or feeling really sicky with this nausea or morning sickness. She just might not be interested. But then women tend to have like a new surge of energy in the second trimester. So whatever the lady, also going along with your partner, going along with the mum's, I guess, mood, and if she's into it, if she wants to try it, then yes, go for it. If she wants to have sex, then yes, go for it. The most important thing as well, though, is you can't have sex if if her waters have broken or if she has any active vaginal bleeding, because we know that happens. Otherwise, oh, and also we discourage women from lying flat on their back from around 16 weeks because it's pressing on a major vein that's sending oxygen to the mom and to the baby. It can make her feel a little bit dizzy. So I know some men are a little bit scared of that. When they're halfway through action, she suddenly feels quite dizzy and out of breath. So that could be because she's lying flat on her back. So it's a great time to just be really adventurous and try other positions. Just avoid lying on her back. And if she does want to lie on her back, then prop her up with lots of pillows. But there's no reason why you can't have sex in pregnancy, as long as there's no outstanding, ongoing issues like water breaking, or if she's bleeding or threatened preterm labor. Yes, perfectly fine.
Okay. I have another question for both of you. Now, some women are still breastfeeding and they get pregnant again. There's the myth that you can't breastfeed when you're pregnant. What's your take on it? For both of you. Tolu, you can go first, then Titi.
This is actually quite a common question. So the last time I did a bit of research on this, I found that you can breastfeed while you're still pregnant. I think the fear is that when you're breastfeeding, you're releasing hormones that can cause you to have a miscarriage, is the most common thing that I hear. But you can, you can breastfeed. Sorry, I'm so sorry. That's an alarm overrides. I'm sorry. You can breastfeed when you are pregnant. But you'll find that as you're going through the pregnancy, your milk will also change, and your baby that you're breastfeeding, the child that you're breastfeeding will also notice the changes and be quite discouraged or naturally fall off and not want to breastfeed. So that's the latest research I've done on it. So I'll throw this to Titi as the expert.
Titi.
Yes, absolutely. You can breastfeed while you're pregnant, but you want to be sure that you're not the kind of person, like Tolu said, breastfeeding could release hormones that could cause a miscarriage, because what happens is that, those hormones can cause contractions in your uterus. So you want to be sure that you're not dealing with other pregnancy-related issues, like having maybe an incompetent cervix or, whatsoever it could be. So we want to be clear that you're not dealing with any pregnancy-related issues before continuing to breastfeed while being pregnant. But aside from that, it's perfectly okay. It's perfectly normal and healthy. And we even find that it makes it makes it easier because, you know, usually when a mom is breastfeeding during pregnancy, just before she gets to, you know, the end of her third trimester, you know, you find that the older baby would most likely come off the breast because of those changes in the milk. But you find that when that has happened, the mother is quickly able to lactate to meet the new baby's needs. So you're not waiting, as against the new mom who just had a baby, we're not waiting 2 days, 3 days, and we have lactation hasn't kicked in. But for a mom who breastfed into pregnancy, you find that it kicks in much quicker and she's able to get more milk out quicker for the new baby. So it actually has some of its advantages.
Okay. Titi, so we have working mothers who are breastfeeding and it's time to get back to work. How would you advise they manage breastfeeding and work, or expressing storing of the breast milk? How would you, what would be your advice to them on how to manage that?
Okay, so you can express, yes, ensure that it's in good, you know, healthy conditions, that your bottles are properly sterilized, or you're using breast milk storage bags that are, you know, sterilized. But yes, you can breastfeed, and you can actually store breast milk. So breast milk that has been left on a countertop or on the table in the kitchen or anywhere at room temperature can be left for 3 to 4 hours. After that, you have to throw it out. If you're putting breast milk in the fridge, you know, you can have it in the fridge for about 3 days. There are about 3-4 days before you toss it out. But you can also put breast milk in the in the deep freezer for a long period of time. You know, for 3 to like 6 months, 8 months. You can have breast milk in the deep freezer. Okay, so breast milk has living organisms in it, so it's not it doesn't lose its efficacy because it has been in the freezer. Okay, so what happens, the only challenge that we find with that is that when you bring breast milk out of the freezer, number one, you don't want to overheat it. Okay, so you don't want to bring breast milk to boiling point. There's no need for that. You can just put it out on the table and let it thaw, and then you sit it in warm water. Okay, but don't put breast milk in boiling water to try to let it defrost quickly. That's killing a lot of the good things that it has in it. And when you're also storing breast milk, be careful not to add fresh breast milk into frozen breast milk. I'll explain what I mean. So if you're trying to build a stash now for work, so you know that your baby feeds 8 times a day, and you're trying to provide those 8 feeds per day for him, it's okay for you to have, you know, your milk in the freezer, and then you pump some and you want to add to it. So, but what you need to make sure is that the amount of extra milk that you're adding to the already frozen milk should not be more than the already frozen milk. Okay, so if you have 30 ml of frozen milk in a bottle, you don't want to add 30 ml of warm milk into it. The most that you should be adding is 15 to 20 ml of milk, because fresh milk will be warm, and when you put that at the same quantity with what is frozen, it tends to defrost it, and we don't want breast milk to be defrosting and refreezing and defrosting and refreezing. Okay, so in that regard, don't add in higher quantity, but you can add in lesser quantity. When it freezes, you can add another smaller quantity. When it freezes, if you want to keep doing that until you have a full bottle, you can do that. Just make sure that you're not putting in what is more than what is already frozen. Okay, and then let whoever is going to be taking care of the baby, the childminders, either at home or in a daycare facility, let them know how to care for the milk. So you don't want them to put the bottle in the microwave. That's very dangerous, because the nipple on the bottle is silicone, and that gets hot really fast. So a lot of times people put the entire bottle in the microwave, and the milk is still cold, but the nipple, the teeth on it is really, really hot, and we don't check that before we give that to the baby. So don't put your milk in the microwave. Don't do that. And also, you know, the microwave is actually harmful. We already know that, you know, this infrared technology is going into our food is not the best. So I advise not to use microwave to heat up the milk. Just let them know, have warm water, not boiling water, just warm water. Sit the food in warm water, and then, you know, it's okay for the baby. And babies, and I'll add here that babies don't need, babies don't need like hot food, like the way adults need hot food or want hot food. Babies don't need that. Room temperature is actually fine. So we are putting the milk in warm water. And that, even if it's formula, even if they're making formula, I don't know, we tend to always want to just want to make baby food with hot water. Babies don't need hot food. It doesn't do anything for them. If anything, I feel that it's more dangerous to offer baby hot food, because if you're tasting that food, your palate is used to some level of heat that your baby's palate and your baby's tongue is not used to. So if you taste it and you feel like, oh, it's okay, and then you give the baby, but it's burning, it's going to burn the baby's mouth. So babies don't need hot food. So even if you're giving, you know, your baby, even if they're making baby formula of the baby, room temperature is actually fine. There's no law, and Nigeria is not so cold that we need to be giving baby hot food to keep the baby warm, you know. And not to deviate, but I think that this is also a good opportunity to actually say also that Nigeria, I mean, we all grew up saying that when a baby is born, they'll wear the head hat, they'll wear the mittens, they'll wear socks, they'll wrap the baby in a blanket, wrap the baby everywhere. Nigeria is hot. Like, we don't need all of that for baby. The baby is okay, the baby is healthy, strong and healthy. We actually don't need to overwrap the baby, because number one, the heat is also not good for baby. So you find that sometimes the baby ends up having like rashes, or sometimes even as severe as respiratory issues, because the baby is suffocating from so much heat. Okay, and the baby is also not comfortable. So we don't always need to wrap the baby, because remember that the womb where the baby is coming from is not, there's no AC there. It's also warm. So the baby is used to coming out into a warm environment like Nigeria. So, you know, I just always feel the need to tell moms, let's tone it down on all the wool bonnets and wool mittens and wool scarves and wool everything for newborn.
Okay, we'll take one question each and get final comments. So, Tolu, would you advise a pregnant woman to exercise? And if yes, how often, what type of exercise, and of what benefit would it be to the mother?
Yes, I would advise pregnant women to exercise. Exercise is great for the mother because it keeps her nice and active. We know that pregnancy is not a disease, isn't it? It's a beautiful experience. And there's no need for a woman to just be sitting all day working or just living. It's actually not healthy, even if we're not pregnant. So exercise also helps to relieve some of the back pain. Women can get pregnancy related back pain. It helps to make your moving just more flexible, your joints more flexible. It helps you to adapt to your bodily changes a lot, or accept your bodily changes a lot better. You're also releasing endorphins, isn't it, when you're exercising and you're doing something? So you'll feel a lot better. You'll find you have a lot more energy, and it will also help you sleep. So exercise is amazing. All studies recommend, or most studies recommend, you exercise if there are no contraindications, or you don't have a high-risk pregnancy, or you don't have any cardiac issues or anything like that. Exercise is amazing. So ideally you want to exercise for 30 minutes 5 times a week. It sounds a lot, but it actually isn't. So it could just be walking, it could be swimming if you swim, low impact exercises, nothing vigorous. You want to avoid, you can even do like a stationary bike, or yoga or pregnancy Pilates, depending where you are in the world. You want to avoid anything that is contact sports. So basketball, netball, football, rugby, things like that you want to avoid. But exercise is really, really great. I do a couple of exercises. So I had like classes that I do antenatal exercises with, and we start off with exercises with Sandra, and the feedback from the women in that group was phenomenal. So now I'm thinking of doing it something more long term for my antenatal clients. So yeah, exercise is absolutely amazing. And also they say it can help you have a shorter labor. So yes, ladies, get out there walking, and drag your husbands along to support you for moral support.
Okay, great. Titi, someone's asking on social media what your handle is on social media, and what does it mean to have an IBCLC?
So my page on social media is at Milky_express. That is MILKY_EXPRESS. And an IBCLC is is the full name. I'll go over that. Is an international board certified lactation consultant, and this is a person who is clinically trained in the management of breastfeeding and human lactation. I mean, obviously there's a long line of training to go through for that, pre-med courses, clinical hours, and then taking the board exam. So that's the board that manages the activities of lactation consultants. You know, for you to be a lactation consultant, you have to go through that process and then take that board exam. So that's who an IBCLC is. That's an international board certified lactation consultant.
Great. So it was wonderful having the two of you with us. Just take final thoughts, comments, advice for new mothers, and then we can come to the end of the webinar. Tolu, you go first.
Sure. Sorry, I keep unmuting. Okay. Can you hear me?
Yes, I can.
Okay, awesome. So my final words would be pregnancy is an experience. So obviously being pregnant, even if you've been pregnant before, this is a new pregnancy. It's to prepare in the best way possible. So, you know, like we're really good at when you're planning a wedding or a party, you have all sorts of different teams. You have a wedding planner, you have someone who's planning your ashrabi, you have caterer or caterers, you have a whole team that helps you prepare. I feel if we apply the same principles for having a baby, a lot more couples will have positive birthing experiences. So you also have to prepare to have a baby. Prepare in every way possible in terms of your reading books, you're attending classes, you have somebody there, a professional that you're speaking to and they're advising you what to do. Even if it's a dietitian, you have people there that you're constantly taking advice from. For people who are not pregnant, but supporting people who are pregnant, I feel, you know, we're constantly talking about baby showers and we focus on the baby. And then we have mums who go through a whole range of emotions after they've had the baby and they're struggling with breastfeeding, accepting their body. Like there's so many things that women struggle with afterwards. So rather than focusing on buying 100 baby grows for this baby that will grow out of the clothes so quickly, let's think about giving mums more practical gifts. So book her an appointment with a lactation consultant, book her a spa, do things that you're also thinking about the mother on her transition to motherhood that would help make this process of her being a mum a lot more easier and enjoyable. That's my last one. Thank you.
Thank you. Titi.
That's amazing, Tolu. Thank you so much. Definitely. Let's also learn to focus on the mom. You know, people come a lot of times when there's a new baby, everybody wants to see the baby, everybody's bringing diapers and wipes, and nobody is really caring for the mom and doing things for the mom. So let's also, learn to focus and show some love to the mom. In terms of breastfeeding, I would say, just as Tolu has said, it's so important to prepare ahead. Okay. I don't want to be the bearer of bad news, But when you know to yourself that I can experience such and such in future, you're better prepared. And when I say better prepared, what I mean is you have the things that you need. So for example, if you know that, oh, there's a possibility that you would have breastfeeding difficulties, you would buy your breast pump before the baby comes. You would have assembled your breast pump. You will know how it works before the baby comes. So we're not waiting. Now the baby has come. Mommy cannot breastfeed. Daddy is going crazy. Everybody's wondering what to do next. So prepare ahead. There are a lot of resources that you can read on breastfeeding. I have a lot of resources on breastfeeding and even a book on breastfeeding so that you can get that pre-knowledge that you need before going into breastfeeding. Prepare yourself, get the knowledge that you need, and work with professionals, okay? I know that for things like this, when it comes to birthing, breastfeeding, we just generally, as Africans, we just have that tendency to always fall back on what your grandma says or what your mom says or what the auntie said or your friend or your sisters, forgetting that they're professionals, that are trained to actually help you with these challenges. So seek professional help. Don't check Google. Google cannot. The truth is that Google cannot help you because issues surrounding breastfeeding or birthing are usually very they're usually very personal. Okay, so what person A will experience will be different from what person B would experience. Okay, so Google cannot give you the right answer that will suit your direct need. So always seek professional help. Let's not self-medicate. Let's not Google for results or whatever we think that we're trying to, get. It's okay to have people that will help you and advise, but always get a second opinion from professionals. Thank you.
Thank you. So everyone, my final thoughts and advice would be take it easy on yourself. Pregnancy is a journey. It's a phase. You would come to the end of that pregnancy phase and have a baby, but don't put too much pressure on yourself. Relax, enjoy the moment, enjoy your baby, and just enjoy, truthfully. So it's a pleasure having you, Tolu and Titi, with us today. We really appreciate your time and your knowledge and your advice. Thank you so much for being with us. And we come to the end of this discussion today. Have a lovely weekend.
Thank you so much. Thanks for having us.
You too. Thank you.
Okay. Yeah.